So students, now I'm uploading the last and the final part of this 101 liner series, that is the part 10, and it has been a really hectic thing for me, and I'm sure I know how much hectic it is going to be for you. आप लोग तो सारे सब्जेक्ट्स पढ़ रहे हो और आपके पास टाइम भी बहुत ज़्यादा नहीं है. So all the best to you, and please go through the video, and by evening I'm going to upload all the questions in the form of a PDF to my next post as a Google Drive link. So you can click on that link and you can download the PDF that is attached there. Now coming to the part 10 of the 100 one-liner series in pharmacology, let's start. Which is a radioprotector? So here, see, remember, amifostin is a drug which is approved to prevent renal toxicity which is caused by cisplatin when it is given for ovarian cancer treatment, and it is also protective against radiotherapy in several cancers. So please remember this, amifostin is cytoprotective. Monoclonal antibody causing cardiomyopathy, we know it is trastuzumab. Finasteride is a 5-alpha reductase inhibitor and it is used in the treatment of prostatic carcinoma, also benign hypertrophic prostate. Most common long-term side effect of tamoxifen is venous thrombosis. Then a girl with acute leukemia is admitted for management, and on treatment she developed tachypnea, fever, pulmonary infiltrates. So what should be done for the treatment? You have to give dexamethasone. Which drug has recently been approved for treatment of prostate cancer? This is digarelix. It is a GnRH receptor antagonist and it reduces the growth of the prostate cancer cells. Chemotherapy is not useful in chondrosarcoma. Which is a widely used drug in the management of carcinoma breast? It is doxorubicin. Treatment of chronic phase of CML is imatinib. Regimen which is used in non-Hodgkin's lymphoma is CHOP. Tamoxifen is used in breast cancer. Monoclonal antibody to interleukin 5 is mepolizumab, we have seen earlier also. Fully humanized antibody is used in treatment of rheumatoid arthritis, that is adalimumab. The only FDA approved radioactive antibody that is used in treatment of lymphoma is ibritumumab. Bevacizumab is a drug monoclonal antibody against VEGF and it is used in diabetic retinopathy. Which immunosuppressive agent acts selectively by inhibiting helper T cells, that is cyclosporin? Which is a calcineurin inhibitor, again cyclosporin? A topical retinoid which is introduced for treatment of psoriasis is tazoroton. An antihelminthic drug which also acts as an immunomodulator is levamisole. Cyclosporin A acts on CD45 cells. Which drug acts by inhibiting RNA synthesis? That is rifampicin. Anaerobic bacteria are resistant to aminoglycosides. Which drug is used for mass prophylaxis of prevention of meningococcal meningitis? That is ciprofloxacin. Which is a beta-lactam antibiotic? It is imipenem. Mechanism of action of vancomycin. We all know it is a cell wall synthesis inhibitor. Vancomycin causes Redman syndrome. Time-dependent killing and prolonged post-antibiotic effect is seen with beta-lactams. The drug resistance transmitting factor which is present in bacteria is plasmid. And the drug resistance is transferred through conjugation. So there is a plasmid conjugation. Pneumococcal resistance to penicillin G is acquired by transformation. Now following is a cell wall synthesis inhibitor. In that, if you are given many options, then mark penicillins or beta-lactams. In staphylococci, the plasmid encoding beta-lactamase is transmitted by transduction. So pneumococci it was by transformation, in staphylococci it is by transduction. Superinfections are very common in immunocompromised host. Please remember this. Which antibiotic does not act by inhibiting protein synthesis? That is vancomycin. Vancomycin inhibits the cell wall synthesis. Which is responsible for antibiotic associated colitis? So that is Clostridium difficile, which causes pseudomembranous enterocolitis. The persistent suppression of bacterial growth that occurs after a limited exposure to some antimicrobial is called as post-antibiotic effect. So a drug is effective even when it is not there. So that is post-antibiotic effect. Then there was an outbreak of MRSA in the hospital, that is methicillin resistant staph aureus, and it is found that the nurse had MRSA colonization of anterior nares. Now, what is the best treatment? Give topical mupirocin. Imipenem is combined with cilastatin because cilastatin prevents the degradation of imipenem in the kidney. So this combination of imipenem cilastatin is more effective because it reduces the degradation of imipenem and makes it longer acting. Red band syndrome is caused by vancomycin. A child admitted with H. influenzae meningitis. Now, cefotaxime is preferred over ampicillin because cefotaxime is more active against beta-lactamase producing strains. Now, which statement about cefuroxime is true? It is rapidly excreted by the kidneys. Which drug is active against Pseudomonas? Pseudomonas ke against we have a combination, that is piperacillin tazobactam. Extended spectrum beta-lactamases are characterized by activity against all except carbapenems. So carbapenems के against जो ये beta-lactamase extended spectrum beta-lactamases है, they are not effective. Cilastatin is given with imipenem. This we have seen. Cilastatin combines and increases the action of imipenem. Vancomycin causes cell wall synthesis. A potent inhibitor of beta-lactamase is clavulanic acid. Mechanism of action of penicillin and cephalosporins is to inhibit. Now they are basically cell wall synthesis inhibitors. Which is not a beta-lactam antibiotic, that is azithromycin. It does not act by the, it is not a beta-lactam antibiotic, it is a macrolide and it acts by inhibiting the protein step in the protein synthesis. Third generation cephalosporins that can be given orally is cefixime. Ampicillin is used in listeria, which is not a beta-lactamase resistant penicillin, that is carbonicillin. The preferred treatment option for primary syphilis. So syphilis mein the preferred treatment option is injection benzathine penicillin 2.4 million units intramuscularly in single dose. Oral vancomycin can be used for treatment of, it can be used in pseudomembranous enterocolitis. Which drug is a fourth generation cephalosporin, that is cefpirom? Route of administration of vancomycin in pseudomembranous enterocolitis is oral. Penicillinase resistant penicillin is methicillin. Drug of choice for prophylaxis of diphtheria is erythromycin. Which statement regarding tigecycline is true? That is, it does not require dose adjustment in renal failure. Tigecycline is a congener of tetracycline. So, uske next second generation hai and it does not require renal adjustments. Mechanism of action of linezolid. Now, linezolid is a drug which binds to 30th ribosome and inhibits the tRNA initiation complex. Antibiotic that inhibits protein synthesis by premature termination and which resembles amino acid tRNA is puromycin. Now, linezolid is best used in vancomycin resistant staph aureus, that is VRSA. Streptogramins are not effective against E. coli. Erythromycin is a drug of choice for treatment of diarrhea in children caused by Campylobacter jejuni. Fluoroquinolone with highest oral bioavailability is levofloxacin. Mechanism of action of fluoroquinolone is that it inhibits DNA gyrase. Drug used for treatment of impetigo is dicloxacillin. Clostridium difficile diarrhea is commonly associated with aminopenicillin. Drug of choice for scrub typhus is doxycycline. Which drug is commonly used for community-acquired pneumonia caused by Staph aureus? We use azithromycin. Then Burkholderia cepacia is intrinsically resistant to polymyxin B. Drug of choice for prophylaxis of pneumocystis jirovecii pneumonia in immunocompromised patient, we use cotrimoxazole. Drug of choice for antibiotic-associated pseudomembranous enterocolitis is vancomycin. Drug of choice for syphilis in pregnant lady is penicillin. Drug of choice for treatment of infection caused by methicillin-resistant staph aureus, we use glycopeptides. Which drug can cause cartilage damage? Now, ciprofloxacin is ototoxic. Apart from that, the aminoglycosides are also ototoxic, but they cause vestibular damage. Gray baby syndrome is caused by, that is, it is a wrong, chloramphenicol. Gray baby syndrome is caused by chloramphenicol, not chlorpromazine. Which drug is most commonly associated with Clostridium difficile colitis? So that is clindamycin. Nephrotoxicity is seen with aminoglycosides. Aminoglycosides also cause eighth nerve toxicity, that is ototoxicity and nephrotoxicity. Drug causing megaloblastic anemia is pyrimethamine. Xerix Hexmeyer reaction is seen in syphilis with penicillin. Red cell aplasia can be caused by chloramphenicol. Then drug of choice for plague is tetracycline. Drug with high degree of photosensitivity is doxycycline. Drug of choice in pertussis is erythromycin. Treatment of choice for chancroids is erythromycin. Drug of choice for primary syphilis, we all seen that benzathine penicillin. Drug that is not contraindicated in G6PD deficiency is INH, that is isoniazid. Antibiotic that can be safely given in pregnancy is cefuroxime. Drug of choice for mycoplasma pneumonia infection is azithromycin. Then single dose treatment for chlamydia is azithromycin, which is contraindicated in pregnancy. Tetracycline is contraindicated. It results in bone and calcium deficiency and deformed teeth formation. Drug that can cause hypertrophic pyloric stenosis is erythromycin. Second, even pregnant women may safest is penicillin, we have seen that. Then a drug which causes both ototoxicity and nephrotoxicity, vancomycin, apart from that aminoglycosides also. Which is not safe in pregnancy, quinolones, that means ciprofloxacin, norfloxacin, which can be given safely in renal failure, that is doxycycline. Drug of choice in pneumonia caused by pneumocystis carini is cotrimoxazole. Aplastic anemia is adverse effect of chloramphenicol because it causes bone marrow suppression. Drug used in resistant gonorrhea is spectinomycin. Which antitubercular drug causes ophthalmological toxicity? So that is ethambutol, it causes visual defects. Then which ATT can cause peripheral neuropathy due to deficiency of pyridoxine? That is INH, isoniazid. Pseudojaundice is an adverse effect of rifabutin. ATT which causes orange colored urine is rifampicin. Which ATT is not hepatotoxic? It is streptomycin. ATT most commonly implicated in causing peripheral neuropathy is INH. Which drug is useful in treatment of infection caused by Mycobacterium avium? That is clarithromycin. Then INH induced peripheral neuropathy results from deficiency of vitamin B6, that is pyridoxine. INH can be used safely in the presence of coronary artery disease. Common dose dependent side effect of ethambutol is optic neuritis. Most common drug used in leprosy is dapsone. Bacteriostatic antitubercular drug among the following is ethambutol. In lepra reaction, the drug which is useful is clofazimine. Treatment of lepromatous leprosy is rifampicin plus dapsone plus clofazimine. This is the therapy regimen for lepromatous leprosy. Drug that crosses placenta, isoniazid, rifampicin, pyrazinamide, they all cross. Drug used in prophylaxis of H. influenzae is rifampicin. Maximum sterilizing action is shown by which anti-TB drug? That is pyrazinamide. ATT associated with psychosis rarely is INH. Then drug causing ichthyosis, hyperpigmentation when used in leprosy is clofazimine. Isoniazid neuropathy can respond to pyridoxine. Then which ATT precipitates gout? That is pyrazinamide. Which drug is not used in the treatment of leprosy? We don't use kanamycin. ATT safe in hepatic failure is streptomycin and ethambutol. Then following ATT should not be given to AIDS patient, that is rifampicin. This was even asked last year as a story question, that a patient came to doctor and she is taking anti-HIV drugs and recently diagnosed with tuberculosis. So which drug should she not take? Then least hepatotoxic anti-TB drug is ethambutol. Drug of choice for invasive aspergillosis is voriconazole. Mechanism of action of oseltamivir. Oseltamivir is a neuraminidase inhibitor. Then mechanism of action of triazoles which are used in fungal infection is inhibiting the ergosterol synthesis. Avian influenza is treated by oseltamivir. Topically used antifungal agent is clotrimazole. Drug of choice for chronic hepatitis B is lamivudine. Lamivudine is the drug which is also effective in HIV. Mechanism of action of terbinafine is inhibition of ergosterol synthesis. Most serious adverse effect of ketoconazole is adrenal insufficiency. Then antifungal drug which can be used as a cancer chemotherapeutic agent is flucytosine. Drug used to treat acyclovir resistant herpes simplex virus, varicella zoster virus is foscarnet. Then antifungal which has action against dermatophyte infections is terbinafine. Drug of choice in herpes simplex, encephalitis and keratitis is acyclovir. Then patient of HIV is on treatment with following drugs and he develops nephrolithiasis, hyperlipidemia, and central obesity, hyperglycemia, and insulin resistance. So which drug is responsible? Please remember this is indinavir. Which drug has a dual action on HIV and hepatitis B? That is lamivudine and emtricitabine. This is also effective. Mechanism of action of protease inhibitors is that it prevents the maturation of new viral particles of HIV. A person is being treated for HIV, develops hypertriglyceride and hypercholesterolemia. So the drug which is implicated is ritonavir. Zidovudine and diadenosine, they are used in heart. They act by, we know that they are nucleoside reverse transcriptase inhibitor. So with this we come to an end of the part 10 of the 100 one-liner in pharmacology. Total, so now we have around 1040 questions and I'm going to upload them in a PDF format and a Google Drive link in my next video.